Chapter 23. Let's start with some key definitions. Stenosis means a narrowing of the valve so it doesn't open fully. This reduces forward blood flow and decreases cardiac output. Think of it like trying to push water through a partially closed faucet. It limits flow. Regurgitation, or insufficiency, means the valve doesn't close completely. Instead of blood moving forward, some of it leaks backward. This forces the heart to work harder to maintain circulation and can eventually lead to heart failure. These terms, stenosis and regurgitation, form the foundation of all valvular disease. Let's quickly review normal circulation. Unoxygenated blood flows from the superior and inferior vena cava into the right atrium, through the tricuspid valve to the right ventricle, then across the pulmonary valve into the pulmonary artery. From there, blood travels to the lungs, where it becomes oxygenated, then returns through the pulmonary veins into the left atrium. It passes through the mitral valve into the left ventricle, and finally across the aortic valve into the aorta, where it supplies the body. When any valve in this pathway becomes narrowed or leaky, it disrupts this entire sequence. Please watch this video. Arthralgia is pain in the joints. Polyarthritis is inflammation of the joints that causes pain in the joints. Rheumatic fever is an autoimmune reaction that occurs about 2 to 3 weeks after an infection with group A beta hemolytic streptococcus, the bacteria that causes strep throat. The body's immune system mistakenly attacks heart tissue, leading to inflammation and possible long-term damage to the heart valves. The good news is, it's preventable. Prompt treatment of strep infections with penicillin or other antibiotics can prevent rheumatic fever and the resulting valvular disease. With mitral valve prolapse, one or both flaps of the mitral valve bulge backward into the left atrium. When this happens, the valve may not close properly, and blood leaks back, called mitral regurgitation. Many patients are asymptomatic, but some may experience palpitations, chest pain, or dizziness. It's often detected by a mid-systolic click on auscultation. Nursing care includes patient education, avoiding caffeine and alcohol, which can worsen palpitations, and monitoring for worsening symptoms. Mitral stenosis is a narrowing of the mitral valve opening, usually caused by rheumatic fever. This narrowing obstructs blood flow from the left atrium to the left ventricle. As pressure builds in the left atrium, it backs up into the lungs, leading to pulmonary hypertension and right-sided heart failure. Patients often present with shortness of breath, fatigue, and sometimes a cough with blood-tinged sputum. Mitral regurgitation means the mitral valve does not close completely, so blood flows back into the left atrium during systole. This creates volume overload in both the atrium and ventricle. Over time, the heart dilates and weakens, leading to symptoms of left-sided heart failure such as dyspnea, fatigue, and orthopnea. We monitor for atrial fibrillation, which is a common complication due to the enlarged atrium. In aortic stenosis, the valve between the left ventricle and the aorta is narrowed, forcing the heart to pump harder to eject blood. This can lead to left ventricular hypertrophy and eventually heart failure. Classic symptoms are angina, syncope, and dyspnea on exertion, often remembered as the triad of aortic stenosis. Aortic stenosis is serious, and many patients will require valve replacement. Please watch this video. Corrigan pulse, forceful palpated pulse that collapses quickly. With aortic regurgitation, blood leaks back from the aorta into the left ventricle during diastole. This causes the ventricle to enlarge and weaken over time. Patients may develop a bounding pulse and widened pulse pressure. Symptoms include fatigue, palpitations, and progressive heart failure if untreated. Corrigan pulse, forceful, palpated pulse that collapses quickly. For all valvular disorders, nursing care focuses on monitoring for heart failure signs like dyspnea, edema, or weight gain, teaching patients about activity restrictions, monitoring for atrial fibrillation and anticoagulation needs, educating about long-term follow-up since these conditions are progressive. Our role is to balance activity and rest, optimize cardiac output, and support patient understanding of their condition. Treatment often requires surgery. Options include minimally invasive surgery using endoscopy or robotics, traditional open-heart surgery with cardiopulmonary bypass, transcatheter aortic valve replacement (TAVR) for high-risk patients who can't tolerate open surgery. The goal is either to repair the existing valve or to replace it with a prosthetic valve. Repairs are often possible and preferred because they preserve the patient's natural valve. For stenosis, procedures include balloon valvuloplasty or commissurotomy to widen the opening. For regurgitation, we use procedures like annuloplasty, where the valve ring is tightened to help the leaflets close properly. Sometimes repair isn't possible and the valve must be replaced. There are two main types: mechanical valves, very durable but cause turbulent blood flow, so patients require lifelong anticoagulation with warfarin. Risks include bleeding, anemia, and infection. Biological valves made from pig, cow, or human tissue. These don't require lifelong anticoagulation, making them better for older adults, but they wear out faster. We also respect cultural or religious concerns around using animal tissue. Corrigan pulse, forceful palpated pulse that collapses quickly. Corrigan pulse, forceful palpated pulse that collapses quickly. Infective endocarditis is an infection of the inner lining of the heart, usually caused by bacteria entering the bloodstream. Risk factors include IV drug use, prosthetic valves, and prior valve disease. Classic signs are fever, new heart murmur, petechiae, and Janeway lesions on the hands and feet. It requires prolonged IV antibiotics and sometimes surgery if valves are badly damaged. Corrigan pulse, forceful palpated pulse that collapses quickly called chissine. Severe, corticosteroids, if NSAID is not effective. Pericarditis is inflammation of the pericardium, which can be acute or chronic. Patients often have sharp chest pain that worsens when lying flat and improves when sitting up and leaning forward. On auscultation, you may hear a pericardial friction rubbed on. Complications include pericardial effusion and cardiac tamponade, which are life-threatening and require immediate intervention. Corrigan pulse, forceful palpated pulse that collapses quickly. Myocarditis is inflammation of the heart muscle itself. Causes include viral infections, autoimmune diseases, and toxic drug reactions. It can lead to arrhythmias, cardiomyopathy, and sudden cardiac death in severe cases. Treatment is supportive: rest, medications for heart failure, and treating the underlying cause. Corrigan pulse, forceful palpated pulse that collapses quickly. Trauma to the heart can be non-penetrating, like blunt chest injury in a car crash, or penetrating KIMC, such as stab wounds. These injuries can cause arrhythmias, tamponade, or direct damage to the heart muscle or valves. Rapid assessment and intervention are critical in trauma care. Angiotensin-converting enzyme, ACE inhibitors, cardiomyopathy, refers to diseases of the heart muscle. There are three main types: dilated cardiomyopathy, ventricles enlarge and weaken, leading to systolic heart failure. Hypertrophic cardiomyopathy, the heart muscle thickens, restricting outflow. It's a common cause of sudden cardiac death in young athletes. Restrictive cardiomyopathy, the heart muscle becomes stiff, impairing filling. Management varies, but may include medications, implanted devices, or transplant in severe cases. Virchow's triad: venous stasis, reduced blood flow predisposing factors. Immobility, jobs requiring long periods of standing, sitting, or traveling. Postoperative bed rest, damage to vein lining. Do not leave eye catheters in place longer than 48 hours. Increased blood coagulation. Smoking. Oral contraceptives, estrogen therapy, hematological disorders, and abrupt discontinuation of anticoagulants. Finally, thrombophlebitis means a blood clot in a vein with associated inflammation and pain. Risk factors include immobility, surgery, trauma, or clotting disorders. Nursing interventions focus on prevention, encouraging ambulation, using compression stockings, administering anticoagulants, and monitoring for pulmonary embolism, which is the most serious complication. References: